You're listening to Health Professional Radio. My name is Wayne Bucklar and my guest today is Dr. Dwyer. Drew joins us from Australia, where he's a speaker, educator, motivator, consultant and gerontologist. Welcome to Health Professional Radio, Drew.
Yeah, good afternoon, Wayne. How are you?
I'm very well. And I should say, to use your professional name, it's Dr. Drew. So welcome to Health Professional Radio, and do tell us what it is you do.
Well, I'm a consultant gerontologist, so my background is in nursing, and I'm a nurse with a few master's degrees and a PhD. Most of my academic work I did through the Joanna Briggs Institute in the Adelaide University in Australia. So my field of specialty is multidisciplinary healthcare work, specifically around ageing, aged care, community services. And I look at the evidence-based science and I apply it into multidisciplinary healthcare work. So many hands touching one heart, but it requires teamwork and leadership, and it requires quite a bit of specialty wrapped around it.
Now, it's an up-and-coming topic, gerontology. What do you see happening currently in the field?
Well, I mean, I take the work and if you understand gerontology as a science, it is the science of ageing. But as a clinical science, it's very much multidisciplinary. So we have nursing gerontologists like myself, we have physio-gerontologists, we have clinical ones, and we have academic ones that purely look at the science in the academic world of literature. I'm a clinical gerontologist, so I work out in the field. And I gain a lot of my knowledge over the years from working in places like Canada, the UK and America, where gerontological or geriatric nursing is a specialty. It's considered a specialty. And they've been dealing with their ageing populations a fair bit longer than Australia has. We're only just entering the start of our ageing population. And I have no doubt that the gerontological nurse or geriatric nurse specialist, gerontic nurse specialist, will become the new specialised healthcare profession.
Now it's certainly from a business model, a very hot topic amongst investors and business journalists around the place. Has there been a complementary change in the clinical side of things?
Yeah, there seems to be quite a bit of confusion still wrapped around this. The fact is that for a long time now, people have been singing the chorus of removing the medical model from care because it's too medical model orientated. And everyone's been pushing very greatly towards a social model of care and management, which is not too bad as a philosophy and a concept when you would consider the action as being probably and primarily used because the baby boomer cohort is about to come onto the planet in large numbers. And these, of course, people aged between 52 and 72 currently. And probably in the next 20 years, or 10 years minimum, they'll start transitioning over to full retirement and trying to manage their health so that it is living longer and living better. But what we are neglecting is we are experiencing a boom of people entering the aged care community services environment, and these are our older cohorts. These are the great and silent generation, which are the parents of the boomers. Now, they specifically need a more focused medical model because, unfortunately, they have not lived in the zone of having the same healthcare practices that the baby boomers have invented and created and brought to the community. So the older generation still suffers heavily with comorbidity, with complex health disease, and they haven't lived exactly healthy, active ageing lives. They've been traditionally the stoic savers, put away for the legacy of the family and save for the rainy day, and they are quite frugal in their way of living.
Yes.
Well, right now, those people are transitioning into end-of-life, palliation, death and dying, and these are tough subjects to discuss. Many health professionals are reluctant and resilient to discuss them in detail, and it takes quite a bit of specific training to do so. So what we do is we're dancing around the moment healthy ageing, active ageing, positive ageing in a social model context. But the reality is clinicians and people on the front line of care are dealing with comorbidity, complex healthcare, more disability, more frailty, and the language is clouding the direction we should take with our healthcare on these people. So I think we're getting confused a bit, where we're hoping to build this beautiful social model for the boomers, but we are neglecting the fact that many of the elderly now are in need of quite complex and high health care. And we're ignoring some of those factors.
And the boomers are not going to move into aged care gently, I don't think.
No, they're going with much resistance. You see, the boomers are quite active. They want to work, they want to live, they want to be sexual, they want to be engaging, they want to be who they are. I mean, people need to be reminded that the boomers were the sexual revolution in the world.
Yes.
They were the change managers. They organised change. They broke the mould. I often have discussions with my adult children and teenage children about how boomers, and when they want to pull up computers and IT, and I have a giggle and I remind them, we invented it. Mm-hmm. Boomers invented the market. They invented computers and IT. They invented big brands. They invented things that the younger generation now lives for.
Yes.
And the boomers in their right minds have lived a bit healthier than everybody else. So they're trying to plan a bit of a longer retirement span where they sort of semi-retire, semi-engage. And for them, it comes with transition. Many of them are divorced, remarried or unremarried, are looking for lifestyle, companion, and still remain connected to their communities. But the industry itself, as a community, still sees them ageist as old. Yes. And we've got to change that mindset. And I think the best way to change that mindset is to speak about it, talk about it, and educate people about it.
Well, with a little bit of luck, we can help with some of that today amongst our audience. Drew, we get a mainly clinical audience. What's the message that you'd like clinicians to take away as a result of hearing you today? Because 95% of our audience are either in acute care or in aged care, in fact. What's the takeaway for them?
The takeaway, I think, is not underestimate their abilities as clinicians and health professionals. And my motivation here is to focus on nurses and nursing. Nurses are extremely highly educated, talented individuals, and I don't know whether nurses are aware, but again this year, internationally, they've been voted the most important career to the community. So the most valued and trusted person in the community is a nurse. And I think nurses could do themselves a great justice by diversifying their, what they might believe is their career, start to investigate the evidence behind ageing and behind geriatric work and behind who these clients are they see in front of them, and do they actually apply the evidence of science to get the best practice when they are assessing them, transitioning them and treating them, because there is big disparity between the acute and subacute areas of looking after older people and, of course, residential and community settings. One of the clear things people should understand is that hospitals are no place for the dementing elderly. Yes. And people with dementia are complex in late part of their syndrome, and the last place they need to be is confined to a hospital ward or a surgical ward or a medical ward. And the other thing I think all health practitioners need to value and understand is the process of advanced care directives. And when people, as consumers and customers of the healthcare system, have gone to the extent of engaging other health professionals to advise them on their advanced health directives, their not for resuscitation, where they have chosen a pathway that they want respected and managed, then health practitioners should look at it, investigate it, unwrap it, and support its process rather than stick primarily to the we can save your life medical model. Yes, it's going to be... these are big, tough issues at the moment.
It's going to be, I was going to say, a hard conversation has to be had before the baby boomers find themselves in a comfortable environment in their retirement.
Well, that's right. And at the moment, I try to get health professionals to understand the baby boomers are actually your partners in healthcare, because the large percentage of people we're dealing with in the old age cohort are the boomer parents.
Yes.
And boomers are watching their parents and having to support and transit their parents into their end of life. And boomers have a particular way that they would like to see it done because, of course, they are the next cab off the rank.
Mm-hmm.
And I think health professionals would go a long way in healthcare at the moment when they're discussing their older geriatric clients to really focus in with their boomers to understand how do we partner to get the best transition for the elderly, because the baby boomer is the decision maker for their parents' transition really at the moment in life.
Drew, it's been fascinating having the chat with you, but we're running out of time. How can people get in touch with you or find out more information?
And if anybody wants to get in touch with me, I have a website. It's www.dr, and then a dash, Drew, DREW.com. So it's dr-drew.com. And
there's more information and contact details there, I imagine?
There's heaps of contact details there. I have a lot of association with other companies, or particularly a company called Frontline Care Solutions, and I do a lot of online training, recording, seminars and sessions in a lot of things such as palliation, end of life, dementia care, and all of my information and teachings are recordable online and purchasable by people. So I encourage all clinicians who want to extend their knowledge around their older cohort clients to start educating and empowering your knowledge and then translating that and implementing it into your practice. It's not hard to do.
Well, Dr. Drew, it's been a pleasure having you with us today, and it's certainly been informative. Thank you very much for your time.
You're welcome, Wayne. It's been really nice to talk to you and all your listeners out there in the medical world, and I hope they're all having a fantastic day and putting smiles on their faces and those of their clients.
And we'll have to chat some more. I think there's lots of interesting things to be said here.
Yeah.
Now, if you've just missed my conversation with Dr. Drew, the good news is you can contact him on his website, drdrew.com. That's dr-drew.com. You can also find on our website a transcript of this interview, and there's an audio archive as well, both on YouTube and SoundCloud. And so if you've just tuned in and caught the end of us, or if you're looking at us on one of the websites, the full interview is available for download on our archive. You're listening to Health Professional Radio. Our website where you can find those resources is www.hpr.fm. My name is Wayne Bucklar, and thanks for being with Health Professional Radio today.